Very early on, I could see that neurosurgery was right for me. I was always interested in how the mind works, and I was attracted to the amazing field of neuroscience. And I also like helping people in a very direct way, working with my hands and immediately fixing people with complicated problems. And I actually like the challenge of working with patients and families during the most important, most challenging moments in their lives. I'm Dr Yoshor, and I'm the chair of neurosurgery at Penn Medicine. I think it's really an honor and a privilege for us that in a very short amount of time we have to meet the patient and the family and quickly earn their confidence and show with sincerity that we are compassionate, we are knowledgeable, we are skilled, and we're going to give them the best possible care. I'm particularly focused on pituitary surgery and skull-based tumor surgery. A lot of those surgeries are being done using special cameras and instruments through the nose without an incision. And when a patient comes to the Penn Pituitary Center to see me, they're not just seeing me, they're usually seeing 2 or more other specialists, and they receive the benefits of all this expertise all working together to help those patients. I think there really is a great joy when the surgery is working beautifully and you anticipate what's coming next. It is a little bit like a symphony, and it just becomes effortless and just a pleasure. And it's hard to convey that joy. That's why we love being in the operating room. There's no better feeling than that, than taking someone who is about to go blind or lose the ability to function in many other ways and restore them to good health quickly. And the next day after surgery, they look at me and say, wow, I can really see so much better. This is amazing.